Osteoporosis, very quickly, the risk factors: low calcium intake, seizure medications, thin-bowled, drinking too much, though 1 to 2 drinks is actually good for you under all circumstances, better than 0, and that would be true in the nursing home too. Drives everybody crazy, but it is true. Hypogonadism, men and women, prior fracture, excess thyroid hormone. If you are white, you're at more risk. Chinese at more risk unless you squat at the toilet, which is why Chinese hip fractures used to be low, and they got more and more when they moved to the United States, because we don't squat at those toilets. If you've ever tried to squat, it's hard. Other relatives: steroids, inactivity, and smoking. Good dietary sources for calcium. You need to eat about 1 gram to 1.5 grams of calcium a day. That's total. It doesn't mean you need 1.5 grams replacement. You need 1 gram to 1.5 grams a day. Basically, low-fat yogurt gives you 8 ounces. 8 ounces of low-fat yogurt, 415 milligrams of calcium. The average American woman eats 600 milligrams of calcium. So 1 low-fat yogurt will actually do it. The problem is that you need to take it at night before you go to bed, because it's optimal to take your calcium before you go to bed at night. Now, the other problem that's come about is it's been recognized recently that people who take calcium are much more likely to have atherosclerotic heart disease. So this is not good, you know. So another public health great thing. Every woman knows she's got to take calcium. They all take calcium 3 times a day. But what happens? You take your calcium in the morning. I haven't got this in, sorry, so, oh, it's not working. Okay, so you take your calcium in the morning, you take it with all your medicines. Calcium stops the absorption of all medicine. So it stops the absorption of beta blockers. That means you're going to have heart attacks. If you stops the absorption of thyroid, but some days you'll get constipated and you'll finish up on high doses of thyroid to try and get enough in, and then you'll become hypothyroid when you take it. It stops the absorption of anti-seizure medicines. So please be aware, you can't take calcium with medicine. So the best time to take it is at night. Now, you can take your food, and the food will work okay. This is just showing you that calcium plus vitamin D decreases hip fracture. We've talked about the need for vitamin D. You don't need to measure vitamin D. Every single American, virtually, and certainly in the nursing home, is vitamin D deficient. So give them 1,000 units a day. If you are a nurse practitioner, for the 2 at the back, and you go to the casino, like the nurse practitioner who works with me does, your vitamin D will be 7, which is what hers was after about 500 patients that she'd seen that were very low. She said, oh, mine will be fine, and hers was as low as you can go. All our patients are better than hers, so she now takes her vitamin D. If you don't go outside for at least half an hour a day, and by the way, in the nursing home, the best thing is to take people outside for half an hour a day in the sun. It gets them some exercise, and if you do that, you've got enough vitamin D, no matter what it measures. You don't need more than 1,000 international units of vitamin D a day, and as you give more, there's evidence that you may increase hip fractures and other things. So not measuring is a reasonable thing. Just give everybody 1,000 units a day in the nursing home and live with that. The bisphosphonates we've talked about hip fractures. So at the end, how often, where, and when you see somebody, you want to know where they're falling. Was there a loss of consciousness? Is there fear of falling? Remember the orthostasis. Remember visual function. And if you're doing home care, remember those glasses. Teach them not to walk outside with their trifocals. Medications, is there evidence of cardiac disease or seizures? And then the physical therapy, OT interventions. Strength problems, too much alcohol, food-associated hypertension, the environmental factors, syncope, no freedom, restraints, remember that's for bondage only, drugs, sight problems, orthostasis, unsteady balance. Nocturia gets you into trouble with people getting up at night. So at home, try and get them to use a urinal next to the bed, not to get up and walk. I know that I trip at least every week to 2 weeks when I'm going to bed because my house is cluttered. My wife moves everything that I leave in the lounge into the bedroom and tells me it's my job to clean the bedroom. So we get there one day. We get there about once every 5 years. So I'm about due again because I'm falling when I try to go to the bathroom at night. And being an old man, I have to go to the bathroom at least once every night, okay? And don't forget delirium. Simple points. How many times am I going to say orthostasis? Because it's never done. Okay. Appropriate use of canes and walkers, no restraints, remember delirium, treat osteopenia, the hip pads, helmets for frequent fallers. The treatment involves vitamin D, 1,000 units of vitamin D, physical therapy and / occupational therapy, particularly if the person's at home with a home assessment, exclusion of orthostasis, postprandial hypertension, and reduced polypharmacy. So, just to finish up very quickly, a case, an 82-year-old female who lives in a nursing home has had 3 falls in the last week without injury. She has dementia and atrial fibrillation and is on a number of medicines whose indication is not clear. These medicines include calcium hydrochlorothiazide, lisinopril, atenolol, warfarin, amlodipine, memantine. Memantine, by the way, Namenda causes hypotension, severe hypotension, and is associated with falls. So please look for that. Most physicians don't know this. Most neuropsychiatrists don't know it, but we see it very commonly with people who are falling. Seroquel, multivitamins, and Aricept. The blood pressure is 115/60. Pulse is 60 per minute. She has edema of her legs. Her SLUMS, which is a mental status exam from St. Louis University, says she's got early dementia, and her GDS is borderline depression. What needs to be ruled out first in this lady? So you're looking at her, what would you rule out first? So her blood pressure is too low, so you would do orthostasis. Okay, and we have patients who come from cardiologists with this blood pressure, seen 2 days before, and the cardiologist says perfect blood pressure. We stand them up, and they're 80 over nothing. That's not a perfect blood pressure. It gets you into a lot of trouble. What further examination would you like? So we pointed out the orthostasis. Which drugs would you keep her on? So let's go back. So basically, you'd like to give the calcium at night only, most probably on far too many antihypertensive medicines. So she could be dehydrated, so the hydrochlorothiazide could disappear. Question of whether she needs lisinopril and atenolol. Warfarin, you keep people with atrial fibrillation on Coumadin. The reason is, even if they're falling and you think they're at high risk for falls, you need to do this. Why do you do it? You do it because people with atrial fibrillation tend to fall. They tend to have mini strokes. And if you keep them on Coumadin, the fall rate goes way down. So in fact, Mike Rich at WashU has shown this very nicely, that you're safer when you're falling to be on Coumadin than not to be on Coumadin. And people always want to stop it. Amlodipine, another drug which is most probably causing her edema, and clearly her blood pressure is too low, that can go. Memantine, most probably causing low blood pressure, can go. Seroquel, there didn't seem to be much reason for it to be on it, can go. Multivitamin should be replaced with giving her vitamin D, not a multivitamin. There is no evidence that multivitamins are useful for anybody. They give us some of the world's most expensive urine. Americans love to buy all these things from GNC. Expensive urine don't work. There's very little of these that work. Vitamin D does. Okay, and then what interventions would you recommend? So who wants to recommend besides the things we've already talked about? Come on, folks, otherwise I've really wasted my time. What would the OTs like, yeah?
PT and OT eval.
PT, OT, eval. No, I would like the PT and OT to manage, because I sometimes get evals and I don't get management. So I now put evaluate and manage, and I put I want strengthening of, you know, or I want balance, or I want dual tasking. And, you know, I know you say, well, that's a physician interfering. But I actually, because I go to a lot of rehab meetings and stuff, I know what's happening. And I figured my job is to try and teach people a little bit. Yeah, so I'm happy with a PT and an OT eval, provided they have now learned everything I told them today. If you didn't do dual tasking, if you don't do all the things we taught you, then no, I don't want an eval. I want more. I want much more than the evaluate. And remember that you can do home care, PT, OT for people, but the problem is it's limited in time. Somebody who's falling at home, they do wonderfully well. All my patients do perfectly when they're having their PT. 2 weeks after the PT, they start falling again. Why? Because it doesn't matter how many times you tell them to do the exercises, they stop. In Holland, basically, the government pays for the PT, for 6 weeks, and then it pays for your membership to go to one of the gyms, and they pay to train the people in the gyms to do the appropriate exercises with people who are falling, who are older. Now that is a functional government. Isn't it nice to know that we have functional government somewhere in the world? We need to have a functional government who cares. That means you need, whether you like it or not, to have a one-person payer system nationwide. If you want to buy out of it, that's fine. But the basic stuff needs to be available, and if we don't get that, we will continue to be, as I think CNN pointed out for the umpteenth time yesterday, that fundamentally we are getting worse in our outcomes compared to all the civilized countries. We're not comparing ourselves to Indonesia, which actually does slightly better on a number of things than we do. And Cuba is just right where we are. You know, we've got to do better than this, and lots of that is we just don't provide the proper support. We spend huge amounts of money, but it's only for pieces of the population. If you look to also the other thing they showed yesterday, 80% of our counties are doing about as well as the poor parts of the world. The rest, other 20% are doing really well. This is our fault. We are voting for our idiots. And it doesn't matter which party you're talking about, they're all idiots. I mean, at this stage, I have no longer a belief that either party, if the Democrats had the opportunity, they failed, okay? The Republicans clearly will fail because they only care about the rich, at least as far as I can see. And I'm rich, and I would still like them to care more about some other people. Okay, I'm going to stop. I think I've left a couple of minutes for questions.